Good afternoon, everyone. I'd like to welcome you to today's webcast. We are four members of Seyfarth Shaw, and we are just a handful of over 100 attorneys in a variety of disciplines within the firm who together form a task force that has focused on COVID-19 issues in the workplace. We have a number of slides today to review with you, and due to the length of the program, we most likely will not be able to answer questions during the program, but we encourage you to use the question feature on the webinar, submit your questions, and we will respond to your questions after today's program. And before we get started, I do have to read to you the legal disclaimer that's before you. This presentation has been prepared by Seyfarth Shaw LLP for informational purposes only. The material discussed during this webinar should not be construed as legal advice or a legal opinion on any specific facts or circumstances. The content is intended for general information purposes only, and you are urged to consult a lawyer concerning your own situation and any specific legal questions you may have. All right, so thank you. Now that we've gotten that out of the way, we can start the program, which is entitled Returning to the New Normal, What New England Employers Need to Know. Our agenda today will cover 5 topics. We will make the slide deck available after the program, and you'll see, as I said before, we have a rather dense set of slides. We normally don't include as much text, but we've done so on purpose today. The text is really designed to give you information that you can have at your disposal after the program as a resource for you. And so as you can see from the slide, we'll be starting with your return to work framework, and then we'll be talking about issues to consider before employees return to work. We'll go through the return to work nuts and bolts and protocols to consider, and then we'll end the program today with some advisories about staying informed, being prepared, and being flexible in your return to work protocols. Our presenters today are before you, my colleagues, Kristen McGurn, Patrick Bannon, and Adam Young. 3 of the 4 of us are here in Boston. Adam is in Chicago, but we'll forgive him for that. So let's kick it off. I'll start with your return to work framework. And I'll start by saying, look, as we all know, we're in uncharted territory here. We don't have a lot to draw upon as we try to figure out how to return to work, but we do have some reference points. We certainly have experiences in other countries, so the global framework. We have a rapidly developing set of federal, state, and local laws and ordinances and emergency orders. And then within that framework, we also have a number of industry differences that we're beginning to see. So we'll focus on those 3 parts as we talk about the return to work framework. So let's talk a little bit first about what we've been seeing in some other countries. And there are a number of countries who are, weeks, if not months ahead of us in terms of their return to work framework, China being really the first. And what we see generally as a blueprint when we look to countries like China or Germany or Australia is that the return to work is a process. It's not an event or a single occurrence. It is similar to what many of you may have gone through last month or the month before in terms of making decisions about business continuity. So think of it as you thought about perhaps rolling furloughs or business continuity actions that started small and then gained momentum. The return to work is going to be a similar process for you. So openings may be a rolling opening, or openings may be done by phase as you ramp up. And you may be using openings in certain states as either a barometer or a test case for what works or what doesn't work. And so I like to sort of tell people, think of the opening process as a dial that you turn as opposed to a switch that you turn on or off. Um, what we've seen in other countries is that the process of returning to work is a major reorganization of the lives of your employees and your managers. So it impacts really the entire aspect of their daily work lives. What they have to do before coming to work, how do they get to work, um, business travel, how do you deal with business travel? Um, Once people are at the workplace, the physical and environmental surroundings that they work in, the ability to effectively sanitize or clean workplaces. How do you handle social distancing or gatherings? Things like meal breaks or coffee breaks. These are all factors that other countries who have gone through the opening process have had to deal with. And then on top of it, just to share with you, so when Volkswagen, we know that when Volkswagen reopened in Germany, they actually, prior to reopening, redid their entire employee handbook or manual with over 100 changes to different policies and procedures, all designed to minimize the risk of further contamination or further infection or the occurrences of clusters. So we have some experience that we can count on as we think about what reopening will look like. We also know that there are some federal guidelines that were called Opening Up America. Those were issued back in April 16th of this year, and the guidelines focus really on looking at a safe and sustainable reopening of America. And so when you go through the guidelines focus really on empirical data and the presence of either symptoms, the ability to test, whether it's to test for the virus itself or antibody testing, and then encourages governors to work together to formulate reopening plans that work for specific regions of the country and specific states based on their individual experiences with the number of positive cases, the number of testing or tests that are being done, as well as mortality rates. If you look in the middle of the slide, in the middle of April, there was a letter sent to the leadership in Congress by 35 senators, really asking and demanding that the federal government, through OSHA, issue emergency temporary standards requiring employers to develop and implement a comprehensive plan to protect workers. And there's been a lot of attention on this issue, and not just at the federal level, but we'll talk about this in a few slides. We're seeing this also at the state and local level. The ability to adequately protect your employees and to protect the public if you're a public-facing business, that will be paramount in your ability to successfully reopen. There's also other pending legislation that came out of the House Education and Labor Committee. It's called the COVID-19 Early Workers Protection Act of 2020. And similar to the letter that was sent to leaders McConnell and Schumer, this piece of legislation really focuses on responding, I think, to the enormous pressure that the government is feeling about coming up with at least temporary standards, if not permanent standards, for workplace safety. And included in that not only is workplace safety, but proposals for things like hazard pay or premium pay for employees who are working in particularly hazardous or essential industries, to deal with issues like what we have seen and read in the press in the meat industry or in some of the big box retail industries, where we're seeing clusters of employees who are being infected. And lastly, there are also parts of this legislation that include requests for more opportunities, more access, and more funding for personal protective equipment. The last point on this slide I want to make sure I touch on is to remember that as if this was not complicated enough, all current workplace laws continue to apply in this environment. So the ADA, Title VII, OSHA, HIPAA, wage and hour laws, the National Labor Relations Act, all those laws continue to be applicable, and the COVID-19 pandemic does not necessarily override the requirements of those laws. And hopefully you all saw last week that the EEOC came out with new guidelines under the ADA to help employers understand the boundaries of what kind of testing and tests and inquiries they can do that are permissible under the ADA and EEOC guidance. And then last but certainly not least is always keep in mind and continue to check the CDC guidance. The CDC comes out very regularly and frequently with updates, particularly as the country begins to reopen for work. The CDC has sort of robust guidelines of recommendations on what efforts employers can make to create workspaces that are safe for employees and safe for consumers and customers alike. So you'll see in front of you now, I mentioned the concept of state alliances. We all know that there are 3 state alliances that have formed, one on the East Coast, one in the Midwest, and one on the West Coast. And we know that these alliances have actually been working, and we're going to spend a little bit of time talking about what's been happening on the East Coast. But what is consistent among the states in these alliances is the sort of acknowledgement that rapid testing capacity and capability is really the key bridge to being able to bring people back to work. And so you think about the importance of testing, tracing and tracking, and then resources to provide for health and safety in the workplace. So let's move to states that are reopening for business. And we'll focus for the most part on New England, but I will tell you a little bit about what some other states are doing. A couple of themes as we look at the different New England states, and there are themes, even though each state has its own set of guidelines either in process and largely in process, or at least preliminarily released. The themes that we're seeing are the requirement that returning employees wear face coverings either while interacting with members of the public, customers, consumers, particularly when there's no way to avoid being within 6 feet of each other, but that the notion and the requirement of wearing face masks also is being extended to the workplace when employees in the workplace cannot be outside of 6 feet apart from each other. And we've seen those requirements in the guidelines that essential businesses have been dealing with since the onset of the coronavirus. Other themes are policies and practices that mandate that employees self-certify at the start of their shifts that they don't have a fever, that they don't have a temperature above either we've seen 100 and we've seen 100.4 as the triggers, certifying that they don't have symptoms of COVID-19, that they haven't been quarantined, and that they haven't been tested positive for COVID-19, or that they have not been in close contact with someone who's been diagnosed with COVID-19. So these sort of six sort of elements of self-certification, we're starting to see thematically these types of questions and the need for employees to self-certify as a condition precedent to being able to come back into the workplace. Another theme that we've seen is the presence of requiring temperature checks by employers. Now, we haven't seen that across each of the 5 states, but we've seen it in Vermont, and we're seeing it in some either citywide or local ordinances in Massachusetts for businesses that have been operating as essential businesses. But I think that's a theme that we've seen in some other states, and I think you're going to see that in all of the guidelines that are put out by the New England states. You're also seeing themes of providing access to hand sanitizers, washing stations, and other kind of sanitation for high-use areas in offices or other parts of employment, such as elevator buttons and door handles and time punch systems. We've seen thematically limitations on the number of employees and customers sort of per square foot, or if for some states, as they phase and return to work, different phases will have different maximum allowed number of employees in any workspace. Some of it we've seen as a percentage of the workforce, some of it is a hard number, and others are per square foot. So those thematically be looking for that. There have been and will be posting requirements and then obligations to sort of maintain that maximum occupancy limit. And then we've also seen among the different states in New England the notion that where possible, it is encouraged to continue to have your employees telecommute. So what I would sort of tell folks, and I won't go through each of the points on the slide, but what I would tell folks is it's really important to look at your state and city and town and local ordinances and orders, because we see areas where there's less detail statewide. So for example, in Massachusetts right now, as we all know, the governor has put together a reopening advisory board that is meeting with local business leaders and other stakeholders to put together a plan for reopening. But in the meantime, we know that there are city ordinances that have very specific requirements for essential businesses that are operating. And so you need to make sure that you're looking for those, and if you are an essential business, operating accordingly. There is some late-breaking developments in Massachusetts. Yesterday, the governor and the Executive Office of Housing and Economic Development issued some updates to sort of the essential services guidelines, and in essence, really relaxing a little bit those guidelines. So whereas a week or two ago, there were some clear guidelines limiting and frankly almost eliminating the ability of essential and non-essential buildings to satisfy the fulfillment and distribution requirements for online orders, that has been relaxed significantly, and now both essential and non-essential businesses can operate distribution centers, fulfillment centers, and warehouses. There are a number of restrictions on how to do it. They're too numerous for me to get into on this particular program, but suffice to say that it's a good example that changes are developing every single day, and so it's important to be looking at these resources. The governor today in his sort of daily address on COVID-19 made it clear that May 18th, which is the next end date of our extended shelter in place, is not going to necessarily be a sort of mass opening for business. He made it very clear that the opening is going to be a phased reopening, and it's going to be tied to triggers pertaining to the current status of the virus. So we will have more detailed plans in Massachusetts come May 18th. But if I were a betting man, I would say we're not looking at any kind of phase one reopening until the beginning of June. I'll go to the next slide. So similarly, for some of our other states, I wanted to note for folks that states like Maine and New Hampshire have they have a head start on Massachusetts in terms of published guidelines of what their phased reopening will look like. One of the little twists that we see in Maine is that part of their reopening guidelines is including that anyone outside of the state of Maine who travels into Maine, whether it's for work or recreationally, frankly, for any reason, will have to self-quarantine. We've seen even today in some social media announcements from Governor Sununu in New Hampshire that New Hampshire is considering a similar type of order as part of its reopening plan. There's a fair amount of discussion in New Hampshire that access to state parks in New Hampshire and beaches and other outdoor areas will be restricted, at least in phase one of reopening, to New Hampshire residents only. So stay tuned for that. So I apologize for the speed by which we have to go through these. They are developing very quickly, and there's a lot of detail, but you can see that the norm will be that social distancing will continue. It's very much not going to be like it was back in January or February of this year, and not all businesses are going to be reopening at once. It's very much going to be phased, and it's going to be a trial and error, and it'll be tied directly to the empirical data on what we're seeing about either the spread or decline of incidence of infection with the coronavirus. So just briefly, because I know I've taken up some time here, these are some states that have opened up. They have a head start on us. These are by all means, these are not all of them, and it changes candidly by the day. And we will be watching what happens in those states as a guideline for what will be happening in New England. And in fact, Governor Lamont in Connecticut has said as much in his press briefings, and Governor Baker today said the same. So if you have businesses outside of Massachusetts and any of these other states, that reopening process will certainly be a barometer for you. And so lastly here, thinking through some of the industries, obviously consumer-facing companies are going to have to take into consideration issues around customers and how to deal with customers who either are coming into the store or need to be protected. in the industrial and manufacturing industries. We're going to have where you really don't have the option for people to work from home, the ability to create and keep a safe and hygiene environment will be important. Office-based companies will have to think through how to handle clients, vendors, and offsite meetings. And then companies that deal with high consumer density, um, um, such as universities or malls, they will have to think through and be aware of some of the density restrictions that we will see in the phased reopenings across New England. And so now I will turn it over to my colleagues to talk about the plan before employees return.
Thanks, Ariel. So, as Ariel mentioned, we've all businesses have been restricted to some degree and impacted by the last several weeks or couple of months. So we're all facing decisions about who we can bring back if we've sent folks home to work remotely or have furloughed or laid off some of our team members, when we can do that, and how best to do it. Many employers are scrambling to source the face coverings that really all states are saying, and the CDC is saying, should be in use when 6 feet between individuals can't be maintained. Folks are scrambling to find thermometers to undertake additional testing and tracking people's temperatures as they return and gain entry back into the workplace. And all employers really are focused on, in New England, we've seen, the notion of a phased return that will keep gatherings of people small, even in the workplace. So the first step is really to, as Ariel mentioned, focus on which shelter-in-place or stay-at-home advisories or orders currently apply to you and what do they permit or require you to do. And while there have been different rules for essential versus non-essential businesses up until this point, and we know many callers on this line have been in business throughout this period, just operating differently than they previously had. As the Maine governor mentioned, it's sort of now time to remove the focus on those monikers, essential and non-essential, and now focus really on public health and maintaining the health of our employees when we bring them back into the workplace. These orders in the New England states have expressly ranged from face covering requirements to the types of questionnaires you'll be using with employees, to certain types of sick leave and other benefits that employees now may be entitled to that they weren't entitled to 2 months ago. And just to give you a quick sense of the very process that Ariel mentioned is in place in each state and the way in which the process of reopening is being driven by industry, I'll give you a very high level of what we're seeing in the New England states. So New Hampshire began phasing in additional healthcare operations as of yesterday. Retail, barbershops, drive-ins, and golf will reopen by next week. And a week from then, restaurants will be permitted more latitude to operate. In Connecticut, currently, essential retail has been working really nonstop. Manufacturing, real estate, utilities, construction, childcare, and hospital operations have been in place. As of May 20th, Connecticut expects additional outdoor restaurants, additional retail, office spaces, salons, museums, recreational areas like campsites, and university research to be back in business in a more robust way. In Maine, we saw as of the beginning of May, personal services, drive-ins, including drive-in church services, reopen, auto dealers, car washes, and construction being given latitude to reopen. In June, they expect additional hospitality and recreational sites, including camping, with the caveat that Ariel mentioned about out-of-staters quarantining for 14 days. Gyms, nail salons, and retail to be open more robustly come June, and then July and August, hoping for bars, camps, and tattoo parlors and the like to reopen. In Rhode Island, they're starting a reopening plan as of May 9th, which will be in phases of people, 5 to 10 initially in phase 1 being permitted to gather. In phase 2, some restaurants, retail, and salons reopening with 15 gathering. with a recommendation that elderly residents and workers remain home. And then phase 3, permitting 50 folks to gather in schools, offices, restaurants, and retail to be open more robustly. In Vermont, single employee operations have resumed as long as social distance, sanitation, face covering, and sneeze guards can protect workers. As of April 20th, construction and outdoor resale, curbside pickup at restaurants, and wholesale and distribution to support those efforts was permitted. As of April 27th, that expanded to construction, manufacturing, distribution, library, and additional outdoor retail. And all employers as of May 4th were expected to train their workers comprehensively based on information provided by the Vermont OSHA relating to the disease COVID-19 and how to protect against it. All employers really should be thinking about that Vermont training requirement and what they need to do to train their employees, where and how that training should occur, and how it's going to be paid for if handled remotely. Obviously, in addition to the governmental orders and directives that we're all facing, there are OSHA and other health and safety laws that will vary by location, and Adam will talk further about that as we move through the presentation. We mentioned also paid sick leave and unpaid leave that has been sort of overlaid on top of what employers are typically familiar with. So those employers who are subject to the FMLA with 50 or more employees need to continue, as we mentioned, to focus on leave requirements and equivalent state laws as they bring people back into the workplace. But also those employers with fewer than 500 employees now may be subject to the Families First Coronavirus Response Act and need to be paying attention to additional leave requirements, which, as we'll discuss throughout the slides today, we should be anticipating additional enhanced, expanded leave requests as employees are asked to return to the workplace. Those leave issues we are finding, create an opportunity for employers who have collective bargaining agreements in place, and have unionized populations of workers. We expect leave to continue to drive some of those bargaining requirements, along with additional workplace health and safety protocols and any other changes you may be making to your policies and practices. We're seeing unions being very active with respect to expectations that that kind of bargaining will take place in advance, that the kind of exigency that was in place when we sent people home for remote work or furloughed employees or laid folks off, it's hard to imagine that same type of unilateral approach should be taken now in such a phased approach to reopening. So we're expecting that hazard pay, if it's in place, and the sunsetting of that sort of incentive will be an issue that unions will expect to be bargained, obviously, as a term or condition of work. Seniority may govern the way in which your plan to bring people back from furlough or from being laid off will take place. And, of course, if there are bumping rights in a collective bargaining agreement, that may include a requirement that folks wait to determine whether a more senior employee is going to take that opportunity. So the phasing and timing of your approach may need to be affected by your collective bargaining restrictions. Even in circumstances where the government is telling us, for example, in the various New England states where temperature taking is expected, and of course the CDC has recommended that approach, even in those places where there's a mandatory order in effect, the effects of that order on your workforce may require bargaining. And so these labor management relations issues are likely to take primary focus as you return people to work. We're also seeing a lot of fear-based demands for additional leave, and we anticipate that health and safety will be a catalyst for both employee questions about their return to work and union organizing within workplaces. And so our best advice is to expect the request for information from unions, be prepared to explain your process and how you intend to keep workers safe, and speak about that up front. Be proactive about communicating with your unions about your plan, and anticipate potentially needing to produce information to the union about that. The optimal approach to this, once you've assessed what rules apply to this reopening plan, will include a strong leader at the helm who is prepared to make timely and clear communications with the workforce beginning now, and make sure that you're giving people time to anticipate the timing of their return to the workplace. We want to see folks, and we're encouraging our clients to build consensus among the leadership who have a stake in the return. So HR, IT, your facilities, the ways in which your buildings will have to be reformatted to accommodate social distance. Health and safety teams will be instrumental. Office managers and senior management who can help you make company-wide decisions that will affect policy going forward. The organizational approach is going to need to be right for each company and workforce. You're going to need to decide whether to reopen by getting as many people back as quickly as possible versus a slower, more cautious, phased approach. And how important is it for you now to keep employees present in the work site? We may have learned some lessons from all the remote work that has been happening. We'll talk a bit further about that, but that certainly will inform the analysis of who to bring back and when. So deciding the timing of when to bring folks back, as Ariel mentioned, some of this is going to be based on local orders. Some states like Maine and Rhode Island have said that employers can bring back, fives and tens of people at a time, whereas other states are focusing on a certain percentage of work or a certain percentage of people per square foot. And even for those who decide we're going to try to get as many people back as possible to get them off the unemployment rolls and back productively working, recognize that some of those people may resist being paid perhaps more than while they're out. Now with a subsidy that will last until July 31st, then they were paid while working. And that a phased approach may be just more sensible from a public safety standpoint because it may allow for those sort of bringing people back 2 weeks at a time and determining whether we face an additional inflection point in terms of infection. The amount of notice provided to employees matters because folks need to make capable plans both for their potentially modified work schedule and child or elder care arrangements that may need to facilitate a return to work. And then, of course, we need to continue to keep our eye on who's legally permitted to be back in the workplace at any particular date on the calendar. If you're thinking about bringing back furloughed employees or recalling folks who've been laid off, you want to be driving this, obviously, from a place of business need. And so, for example, in healthcare, where we anticipate that elective procedures are soon enough going to be opening back up, and we've seen that happen in other jurisdictions, or as Ariel mentioned, distributorships to assist what was considered non-essential retail previously are starting to open up again and have increased latitude. As you're starting to think about, who do we need in place for these critical functions, you'll also need to be thinking about, will this vary by location? Will we try to avoid locations where hotspots have been experienced? Are we looking for employees to come back who can't capably perform some or all of their job functions remotely? But if you're using any of these selection criteria or criteria that focuses on high performers or the most versatile workers in your workplace, recognize that those are decisions that you need to be taken with care, that there's risk of discrimination allegations or mistreatment or caprice, whether you're bringing someone back or choosing not to bring them back. And so you need to study and avoid those allegations and the sorts of criteria, legitimate business criteria that you applied perhaps when furloughing people or making decisions to send folks home. You'll need to think that same process through and ensure that your selection criteria are legitimate, documented, and safe, and that any unintended impacts on certain populations of your workforce are also studied and avoided. All the states in New England really are asking for a staggered return, and employers are considering changing schedules, shifts by day, start times, or even creating new shifts to avoid what we anticipate to be some commuting challenges. And then employers, of course, need to be thinking about how are they going to anticipate the impact of future requests for leave or the need for leave for folks who are tested COVID positive or have symptoms or are still in an isolation order based on healthcare provider advice. We do anticipate, as I mentioned, expanded requests for return to work or continued remote work, and expect that many employers will find that their overall philosophy toward remote work may have changed. So you want to expect that employees are going to be asking for reasonable accommodations in this time, either based on what is perceived as a disability relating to COVID. Managers need to be trained in advance of returning folks to the workplace to spot these issues, and HR needs to be capably trained to handle what will be a new part of the reasonable accommodation conversation. So we've done a lot of process mapping about how to help our clients manage leave overall, and now with new leave expectations, the Families First Act, and new components of these requests, which we expect will include members of vulnerable populations, folks with senior and child care obligations, transportation challenges. These are all going to become part of the conversation of accommodation of employees as they return to work. Then we need to make sure we are focused on who's safe to cross the threshold. The CDC and the New England states expect that there will be screening processes in place in most jurisdictions in New England, and in all jurisdictions when you're trying to determine if an individual is safe to return from work who has tested positive for COVID-19. We expect that questionnaires and self-certification documents are going to be in place in really every workplace focused on exposure and symptoms. We also recognize that the CDC and the EEOC expect employers to be flexible in this place, because whereas we might have held up for a healthcare provider to provide a certification prior to the pandemic, we know that those folks are quite busy right now and may be unavailable to provide those kinds of certifications in the midst of a reentry period, return to work. So we will expect a lot of self-certifications, and those documents should focus on symptoms, exposure, travel to heavily impacted areas, and a certification that an employee is not in a high-risk category. The symptoms have recently been expanded by CDC guidance, so you should pay attention to the fact that if a certification was previously prepared, it may need now to be revised, but the symptoms include cough, shortness of or difficulty breathing, and two of the following symptoms also: fever, chills, repeated shaking with chills, muscle pain, headache, sore throat, or a new loss of taste or smell. So the certification documents that we're drafting for employers as they bring people back into the workplace are going to be a first step in allowing people to cross the threshold. The EEOC also has authorized medical exams of employees that now include both temperature taking, thermal screens, and other screenings to check for symptoms and to continue monitoring. And as of last week, the EEOC also authorized testing, subject to availability, obviously, but for COVID-19 and antibody testing. The FDA, as of yesterday, has exerted more oversight over those tests to ensure that there is demonstrated efficacy with respect to them, and both as Ariel mentioned, Connecticut, for example, is focused so far on things like hygiene and posters, but a state like Vermont is echoing the CDC testing and survey guidelines, and New Hampshire has contemplated some centralized screening upon entry to workplaces. So each state is going to need to be focused on in terms of returning employees to workforces in those states. And then obviously recognizing that this testing is not at the end all be all, because of course those with fever cannot have COVID, and those with COVID may not show a fever, and someone tested negative today can test on Friday positive. So as we move through these testing criteria, we're going to need to adjust to those changing guidelines and adapt our procedures accordingly. And with that, I'll turn it to Patrick, who will talk about nuts and bolts of returning your people to your workplace.
Thanks very
Patrick?
much, Kristen. Hello. I hope I am audible.
Yep, you are.
Thanks very much, Kristen. You've now heard from Ariel and Kristen about when to bring employees back to the workplace, as well as which employees to bring back. The next 5 slides, I'd like to offer 5 ideas about the nuts and bolts of bringing employees back. I don't have all the answers, but hopefully some thoughts on this subject will be helpful. And I'm going to try to fly through these. Of course, questions after the presentation. Happy to take them because we can't cover everything. One important step in bringing employees back to work is closing out the work from home phase in an orderly way. You know, people started working from home sometimes without a whole lot of planning, and it wouldn't be surprising if there are mistakes and problems. Those are probably fixable today, but they become harder to fix and the potential basis for lawsuits if they remain undetected. So I'll just quickly run through some items that employers should think about to make sure the work from home phase ends cleanly. Get employees to return their equipment and inventory the equipment, the things they've been using to work from home. Some employees may have been using documents either on their personal computers or printed out hard copies of documents, and you want to get those back so they're not floating around and information gets leaked. When people stop working from home is a good time to confirm that they were paid properly, especially if they were non-exempt during the work from home phase. If it turns out they weren't, it's fixable now. It's a harder problem later. You want to confirm that they have taken whatever meal and rest breaks the law required them to be permitted. You want to confirm that you've accurately kept track of their sick time, their vacation time, their PTO time, and as well as any statutory leaves. There's the Federal Family and Medical Leave Act. There's the Family First Coronavirus Response Act if you're under 500 employees. Massachusetts has earned sick time. Massachusetts has paid family leave. Rhode Island has Healthy Families and Workplace, the Healthy Families and Workplaces Act. So you want to make sure that all of those things were done right. And one way to do that employers might want to consider at least is to actually ask employees to confirm that these items have been taken care of properly. There's always a chance that employees are going to try to take advantage and create an issue, but that is balanced out against the risk that there's some problem that no one noticed and it's going to blow up in 6 months or in a year, and you're going to find out about it from a plaintiff's lawyer. So I'm going to move very quickly through this. Step 2 is, let's say that work from home is closed out. The next thing people probably want to do is to plan what is going to need to change when employees return to work. I think it's useful to think of bringing employees back as a hybrid between resuming your business and starting a new business. And for employers that sometimes start new locations, open up new stores or something like that, that might be an interesting model for people to think about. Excuse me, creativity and brainstorming is going to be at a premium because no one's done this before, as people have mentioned and everybody knows. In addition to creativity, we suggest that there be as close a collaboration as possible between the business people at the executive level who are making the decisions and legal and HR, so that people don't make a decision and legal and HR find out about it later and then realize that it somehow affects legal obligations and no one knew. Perhaps less obviously, it's often a good idea, every employer is different, but to involve rank and file employees in the planning process. If you have good employees, some of them are probably going to have good suggestions and good ideas about how their job can be done well and successfully when they return to work. And even if they just give you ideas that you've already thought of, the collaboration with the rank and file employees is going to maybe ease some of the anxiety and make people feel like they're part of the team and make them feel invested in the company as you move forward. I think it's already been touched on that if you are a unionized employer, and New England is union heavy compared to a lot of other parts of the country, you not only want to but probably have to communicate and negotiate with the unions about at least some of the changes that are happening, and that's a big topic. But I'll just flag it for the unionized employers on the webinar. So step 3 is, or point 3 in this 5-point section, is to watch out for new legal obligations. Bringing people back is not going to be just resuming work the way it used to be. And the changes could trigger new obligations. And if you know what those are, that's probably not a big problem. But if you don't stop and think and discover them, they could become a big problem. So, for example, if you change people's pay, if you start paying them hazard pay, you want to think about how that changes their regular rate if they're overtime eligible. If you change a commissioned employee's pay because they're not able to sell as effectively, how does that affect their overtime eligibility or their overtime pay or their bonus? If you reduce salaries because people are sharing the cost of business being down or because they're working fewer hours, you want to watch whether that affects their overtime exempt status. If their duties change, same thing, could affect their overtime exempt status. Schedule changes sometimes require notice under state law. If people change the way they take lunch, just real nuts and bolts, if they no longer can leave and come back as easily, or it becomes hard for them to do that so they don't do it and they work at their desks, you want to watch out to see whether those changes are causing lunch break or meal break problems. And if you have people going through processes pre and post work, either taking their temperatures at home or waiting in line before they come into the facility, or cleaning after they go home, you want to watch out for whether any of that is compensable time. And then, as I mentioned, I think if pay and schedules are changing in a significant way, you may have obligations under state law to notify employees of the changes. I'm going to continue flying through here so I can leave some time for Adam. This would be a great time to update your policies. A lot of employers have changed the way they do things on the fly by necessity, sometimes with a policy that was put together quickly and sometimes maybe without one at all. It's a good idea to make sure those policies jibe with the other policies in your handbook. And in addition, it would be a good idea to look through the handbook and see whether there are other policies that now need revision or changing to make them consistent, or just because the world is now different. There are lots of examples. We have a checklist. I was going to run through them, but I probably should just fly through just a couple of examples. You might want to have an infectious disease control policy, a social distancing policy. You might want to change your telecommuting policy, your travel policy, expense reimbursement policies, what's expensable and what's not. You might want to look and make sure your process for people requesting accommodations is broad enough. Now you're not necessarily only talking about ADA disabilities. You might be thinking more broadly. Employee assistance programs, you might want to make sure that those are highlighted, and if you don't have them, consider getting them. Emergency daycare. How are you hiring? Does your hiring process change as a result of all this? It probably is a good idea to just go through the whole handbook and look at every policy. You might want to keep in mind that you can have policies that are temporary. You could have sunset provisions if you are optimistic enough to think that this may pass and the world may someday go back to something like normal. Or you could not. You could just change them indefinitely. And there are forms and templates that you might want to have that will save a lot of work for HR and for the business people. We can help with all those. There's a lot there. And then finally, before I turn it over to Adam to talk about some safety issues, you want to make sure you communicate with employees closely. You always want to do that, but at this time in particular, whatever the new policies are, let them know what they are every way that you can, as quickly as you can. You might want to think about it as if it's a new employee orientation. If an employee's coming back to work, they're not a new hire. You know who they are, but in some ways they're coming back to a job that's not the same job they had held before. So you could think about having almost like a return to work orientation or training. There are posting requirements under a lot of these laws, as I think we've talked about. And last thing is, if you are if you've been doing posting for potential applicants, you want to look and see whether you've changed that. Maybe you're not hiring anymore and you should take those down, or maybe the jobs have changed and you should reflect that in your posting. And with that, I will turn it over to Adam.
Thank you very much, Patrick. Good afternoon, everyone. I'm supposed to talk about the COVID-19 protocols and precautions you can consider, but obviously our time is very limited. There are numerous protocols and precautions. If you have any questions, whether it be on screening, on COVID-19 testing, on face coverings, on contact tracing, we have template policies. We have template flow charts to help people on each of these issues. Feel free to email me or email someone else on this call if you'd like to receive any of those documents. In terms of the regulations that are governing COVID-19 policies, there are no OSHA regulations from either OSHA or Vermont OSHA, which is a state plan state. Employers have a general duty to make a workplace that's free from any recognized hazard, and liability under OSHA, it's based on that recognized hazard, and it's based on your abatements being insufficient. So you're not complying with what's recognized in the industry. Essentially, what that creates is a duty for employers to follow that CDC guidance, the OSHA guidance, the state guidance where it's appropriate, and think proactively and institute protocols and procedures that'll protect employees. OSHA and state agencies, at least anecdotally from the folks I've spoken with, have received something like 30 times the normal amount of complaints that they've been getting. They've been doing inspections. I'm defending inspections now for COVID-19 fatalities and COVID-19 severe illnesses. I'm looking into those policies and procedures. I can tell you, we're working with clients that the best way to be able to respond to those is show all the good faith attempts that the employers made to look at that CDC guidance, look at the retail guidance if it's a retailer from OSHA, look at the manufacturing guidance from OSHA if it's a manufacturer, and the different protocols and procedures that are in place. Thinking generally about safety protocols, there's a descending order of effectiveness and preference. You have eliminating a hazard, then you have engineering controls, then administrative controls, things like social distancing, and then personal protective equipment, which is kind of the lowest and less effective method. It's a little bit different with COVID-19 in that, sometimes social distancing may be more valuable than different engineering controls like plexiglass, but we'd be happy to discuss all those further. In terms of social distancing, everyone understands that that's what the CDC recommendation is. It's based on that 6 feet, or more than 10 minutes of exposure. Social distancing protocols are not an absolute. It's recommended to do where it's feasible, and many times it's not feasible. You have two maintenance guys that need to install a part. You have a chicken processing facility where people have to stand near each other. Sometimes it's not feasible. We recommend you do an assessment of the risks in your specific workplace, and you come up with effective solutions to deal with that and address those. And that a lot of times is going to include some sort of face covering, not necessarily to protect the employee from receiving infection, but to prevent infections from being spread. So we'll catch those aerosolized droplets and prevent viruses from being spread. This slide talks about different protocols you could take, redesigns to limit interactions. That's typically going to be an administrative control. Training employees. The biggest negatives I see in employee trainings is that it's very general. Maintain 6 feet of distance. Why don't you provide them specific advice on, in this area, in the bathroom, what am I supposed to be doing? And when I'm working on the line, what am I supposed to be doing? If I need to talk to my supervisor, how do I get a hold of them? If it's loud in there, those sort of issues. We go on to the next slide. This talks about some different reconfiguring work schedules to keep people apart. We have employers who are closing lunchrooms. They're having people eat in their cars. They're staggering the shift to prevent interaction, and that's prevent those types of engineering or those types of interactions of employees. We recommend, to deal with the COVID-19 issue, you have to have protocols. You have to have a task force in place. And that task force is going to be necessary from almost every end. You're going to have to be tracking the CDC. You're going to be developing your protocols and procedures. You're going to be putting out training to employees. You're going to be responding where you have a positive or suspect case of COVID-19. So I have a flow chart that I can provide you if you're interested, and I'll take you through each potential reporting or discovery of a COVID-19 case, how your task force or managers have to respond, who you need to notify, the cleaning you need to do. Maybe you're going to close the facility. That's a protocol you'll develop. And by having that structure in place and by responding as quickly as you can to each of these issues with an effective contact tracing and effective policy, that's how you're going to minimize the exposures to a potential COVID-19 infection. We're coming about to the end of our time here. So if I'll go through, you can read the slides, learn about clean-in considerations. Visitors can be just as infectious as anyone else, so you want to have the same screening, face covering policies that you have for your regular employees. If you do have contact tracing, we recommend determine who has specific close contact with the infected employee, and getting that information to that employee as soon as possible. You can do it in a private way to not reveal the personal information of the person who has the illness, but you want to make sure that you can try to limit that person from exposure in the workplace or from exposing other people as quickly as you can. Testing is becoming much more common. We have a lot of employers that are developing protocols how to do COVID-19 testing of employees. As Kristen said, it's a limited tool, right? It's only going to tell you if somebody's sick at a specific time when the test is done, and there may be some false negatives and false positives associated with that. But it makes sense to develop your protocols before all the tools are available as to the different way you're going to effectuate that. All right. So why don't I turn things over back to Ariel, who's going to close things out for us.
Sure. Thanks, Adam. Before we close things out, I want to share with folks the CLE code. So if you have a pen or pencil on a piece of paper, please write this down. The code is SS as in Seyfarth Shaw 7464. Again, the code is SS as in Seyfarth Shaw 7464. So as we conclude, I think you've heard from everybody the importance of monitoring for new legal requirements. We have guidance coming out nearly every day. The CDC guidance is very important. I would add to this OSHA guidance, EEOC guidance, state and local emergency orders and laws. And of course, as we said in the beginning, watch what other countries and other states that have already opened up, what they are doing and what experiences they are having. As I think Kristen and Patrick talked about, be prepared, that everyone is predicting that we will have some sort of second wave. So learn from this first wave. Learn from the layoffs or the furloughs or the wage reductions that you have done. Be prepared that you might have to do some version of that again. Develop a protocol, as Adam talked about, of how you deal with employees who may get sick or who may need other forms of leave. Unfortunately, be prepared for a potential shutdown, whether it's location specific or state or county wide. And then lastly, be prepared and flexible. So as Patrick talked about, have a good communication plan in place. Keep communicating with your employees, particularly as we still are remote and we have folks who will stay remote. Really important to keep those folks engaged with the organization. You want to be able to quickly reach your entire workforce. And if you haven't developed sort of a media and PR strategy, certainly now's the time to do so. So we thank you for staying a little bit late. We do have questions. We've seen them come in, and we will respond to those questions. We'll respond to them to you directly. So thank you. Everybody be safe and be well.
This concludes today's webinar. Thank you for attending.